Welcome to Innovators, a series where we sit down with thought leaders across the healthcare space to discuss some of the industry's most pressing topics. And joining me today is Adam Kansler, Inovalon CEO. Today, Adam and I are going to be talking about the future of healthcare and the critical role that data and technology will play. Really looking forward to the conversation today, Adam.
Thanks, Justine. It is great to be here. I appreciate you doing this podcast. I've been a fan of Innovators for a while, and I'm super excited to be here.
Awesome. Well, thank you. So to get started today, let's start with what drew you to Inovalon? What excites you the most about being here?
What a fantastic company. Inovalon's been driving data in healthcare for over 25 years and improving the outcomes for its customers and for patients. For me, the opportunity to operate in the intersection of healthcare, data, and technology, it allowed me to bring some of the experiences I've had over many years to a new industry, healthcare, which I think is one of the most important today. For me, joining Inovalon, a company already with such a substantial history in using data to drive better outcomes for our customers, was an incredible opportunity. So thrilled to be here.
And Adam, we're certainly happy to have you here. There has certainly been a lot of transformation in the last 25 years of Inovalon. So tell us a little bit more about what that means and how it's positioning Inovalon for the future.
There's been tremendous transformation at Inovalon already. Today, we're a scaled provider, national scale provider of cloud-based solutions out to the healthcare ecosystem. The quality of our data sets, the quality of our solutions has to continually improve in order to serve the customer base that's under increased pressure. They have increased cost pressures. They have increased pressure to deliver great care to their constituents. They have increased pressure to make sure that they're operating their own systems with the highest levels of efficiency so that they can actually turn back to their customers the greatest possible care. Our solutions need to keep up with that, and that requires constant transformation. Our ability to use data interoperably through all of our solutions, our ability to have the highest levels of accuracy in our data, be able to serve things up in real time so that providers or payers that are in the middle of processing a claim or helping a patient have the best access to the most accurate data at the most real-time capability. That's where we can make a difference for the outcomes for both our customers, our immediate customers, and ultimately for the patients they serve.
Absolutely. And I mean, that kind of segues nicely into this next question of what is shaping tomorrow's care? What does that look like? And how is Inovalon really enabling that as of today?
I think we've got to respond to all of the pressures that you see in the system of delivering better care in more real time at a more efficient and effective rate. And that's exactly what our tools are designed to do. Think of an example like a nurse that's treating a patient in a hospital. Access to real-time data of that patient's historical care, other things that may be going on with the patient, having that be accurate and as current as possible influences the speed and the efficiency with which care can be delivered. Think of it from a data perspective on something like breast cancer screening, where through using our data sets, plans can look at how levels of screening within the marketplace changes the outcomes for patients. They can look at impacts like geography or income or language and look at screening rates and see how that impacts ultimately healthcare outcomes. By understanding that, it allows them to think about where they need to do increased intervention or increased education or changes in the way they reimburse around the types of procedures that can give them ultimately better outcomes. Those uses of data I see in the future is becoming mandatory because for the plans to operate and for the systems to operate at the right levels of efficiency, they're going to need those kind of real-time data tools, those kind of workflow tools that integrate data in the right way so that they can make the best decisions in an efficient and timely manner.
And, part of this data and technology that we are talking about so heavily, got to talk about AI. It is transforming industries across the globe. How do you see it impacting healthcare, and what role do you think it's going to play in an Inovalon strategy?
I think absolutely critical, and I think it will be a game changer. A couple of things to think about. AI in the field of healthcare needs to be managed really carefully. We're talking about super sensitive, super important data sets. There's no room for errors or for hallucinations in the kinds of things that we're helping our customers do. So the responsible implementation of AI in places where we know it can be helpful. Some of those places are, for example, finding information in a medical record that someone would otherwise have to sift through hundreds of pages of an electronic health record, where we can use AI to help find that information very quickly for a physician and process it or connect it to other pieces of information in a way that gives a very quick insight. Ultimately, that's got to go in front of a proper reviewer, a physician, or whoever's reviewing the particular information for a purpose. But we can cut down on the amount of time necessary to find that information so significantly through the use of tools like AI. I think that holds tremendous promise for the entire healthcare system, and certainly we need to play our role in delivering out the tools that will help our customers utilize it in the most effective ways.
Absolutely. And looking at kind of your history prior to Inovalon, you spent years leading innovation in the financial sector. Can you tell me a little bit about how those experiences translate into the world of healthcare?
Yeah, some things have real parallel. Also, a highly regulated industry, an industry where small errors in data, small problems in workflow can have significant impact. Not quite the level of impact as we have in healthcare, where people's lives can in many ways be impacted, but certainly an area where consciousness of regulation, the importance of data protection, the importance of data provenance and quality, all are at the absolute highest level. That's an exciting place to operate because if it was easy, everybody would do it. So it's fun to take on a challenge in a space where we know it's not simple, but we also know that the stakes are high and the potential impact is high if we get it right. So for me, the two industries, similar. I've had a great career in financial services, but this to me is the next level of conquering a really significant challenge that has such significant impact if we get it right.
Yes, definitely. There are a lot of healthcare technology companies out there. You're now part of Inovalon. What would you say is setting Inovalon apart?
Well, for one thing, our scale. We operate across so many different parts of the healthcare ecosystem: providers, payers, pharmacies, life sciences. That scale allows us to take the nation's best set of real-time data, connect it through our systems, and really be a game changer in what we're able to deliver out to our customers. That, for me, is a real difference between what Inovalon can do and maybe what many of the others in the marketplace can do. We'll look to continue building on that and set our bar and set our sights very high on how we can maintain that scale and that position in the marketplace of a trusted source for delivery of some of the most important solutions and data sets. It's a very exciting place to be, especially in a space that still has so much more to do.
And there have been so many advancements over the years in healthcare, but what do you think is next as far as healthcare technology advancements?
I think you're going to see things become more real time. I think I mentioned this earlier. The expectation of having a full data set, the importing of external data into a particular patient's case. So understanding how observations outside of this particular individual bear on a diagnosis for a particular individual. That's all data-driven, and getting those workflows right and making sure the best minds that are treating patients have access to that broad set of data and tools, I think you're going to see that continue to accelerate, and that will have implications for preventative care, for acute care, for every aspect of healthcare in the country. I think you'll see that continue to accelerate, and even at a faster and faster pace as many of the tools like AI and others that we've talked about continue to have broader implementation and adoption.
So before we wrap up, I've just got to ask, what is one message to Inovalon's partners, customers, and even the broader healthcare community that you'd want to share today?
Nothing is more important to us than our partnership with you. The scale that I talked about earlier, that comes from our engagement with the many customers that we serve. It is a virtuous cycle. The more we engage with you, the more we're able to take the scale and capabilities that we've delivered at Inovalon and make them available to you to create more value in your businesses. So for us, it's let's lean into that partnership together. We know we can do more for you, and we know that by doing more for you, we'll make our offerings even stronger, allowing us to continue to do more and more.
Well, Adam, thank you so much for being here today. Healthcare certainly has come a long way, but it's clear there is so much on the horizon. And it's very exciting to be a part of Inovalon. So, Adam, thanks again for sitting down with us, and I'm really looking forward to your leadership as Inovalon continues on this journey.
Well, thank you. It's super exciting to be here. We're obviously just at the beginning of my tenure. I can't wait to see what we're all going to do together.
Yeah, absolutely. Thank you.